CNA Specimen Collection Labeling. Welcome to the quiz. Question 1. You are preparing to change the bed linens for Mr. George Martinez, a 71-year-old patient whose bedding has become soiled with urine and feces due to incontinence. You understand that when handling soiled linens and caring for incontinent patients, specific infection control precautions need to be taken to prevent the transmission of infectious agents from body fluids to yourself, other patients, or the environment. When changing soiled bed linens and providing care to an incontinent patient, which infection control precautions should you use? Option A. No special precautions are necessary when handling soiled linens, as long as you wash your hands at the end of your shift. Option B. You should use standard precautions including wearing gloves, handling linens carefully to avoid dispersing contaminants into the air, placing soiled linens in designated containers, and performing appropriate hand hygiene after care is completed. Option C. You should wear a full hazmat suit including respirator, goggles, and all protective equipment because urine and feces are extremely dangerous. Option D. You should wear only a surgical mask without gloves, as the mask will protect you from any infectious agents present in the soiled bedding. The answer is B. Standard precautions apply for contact with body fluids. Gloves are essential and soiled linens must be handled to minimize contamination. Option B is correct. Option A is wrong. Hand hygiene alone is insufficient. Gloves are required. Option C is overkill and unnecessary. Option D is wrong. A mask does not protect hands from contamination. Question 2. You are caring for Mr. Stanley Brown, a 75-year-old male patient who reports experiencing constipation and has not had a bowel movement for 3 days. He is uncomfortable, complains of abdominal bloating and discomfort, and is concerned about his bowel function. He is looking to you for advice about what he can do to help relieve his constipation. You know that there are several non-pharmacological interventions that can help promote bowel function before resorting to medication. Based on your knowledge of interventions to promote normal bowel function and relieve constipation, which action should you recommend first? Option A. Immediately administer a strong laxative medication without waiting, as medication is the fastest way to relieve constipation. Option B. Increase the patient's fluid intake, encourage him to eat foods high in dietary fiber, and encourage ambulation and movement if medically appropriate, as these measures promote normal bowel function. Option C. Place the patient on complete bed rest to allow his bowel to rest and recover and restrict his food and fluid intake. Option D. Give the patient only clear liquids and foods with no fiber or bulk, as this will prevent further constipation from developing. The answer is B. First-line interventions for constipation are non-pharmacological: fluids, fiber, and mobility. Option B is correct. Option A is wrong. Administering medication is outside CNA scope and not the first step. Options C and D are wrong. Bed rest and low-fiber diet worsen constipation. Question 3. You are assisting Mrs. Betty Thompson, a 70-year-old female patient who has gastroesophageal reflux disease, GERD, with positioning and comfort measures. She frequently experiences heartburn and acid reflux, particularly when lying flat in bed. She is uncomfortable and asking for your help in finding a position that will be more comfortable for her symptoms. Based on your understanding of positioning for patients with GERD and gastric reflux issues, which position would be most comfortable and therapeutic for this patient? Option A. Lying flat on her back in bed would be the most comfortable, as this allows the esophagus to relax and the stomach to empty more easily. Option B. The semi-Fowler's position, head elevated 30 to 45 degrees, or high Fowler's position, head elevated 45 to 90 degrees, with support provided by pillows would be most comfortable, as elevation helps prevent reflux. Option C. The prone position, lying face down, would be most therapeutic for her reflux symptoms, as this position helps with digestion. Option D. The Trendelenburg position, head lower than feet, would help with her heartburn, as this position aids with stomach emptying. The answer is B. Elevating the head of the bed uses gravity to prevent stomach acid from flowing back into the esophagus. Option B is correct. Option A is wrong. Lying flat worsens reflux. Option C is wrong. Prone does not help and may be uncomfortable. Option D is wrong. Trendelenburg, head down, actually promotes reflux. Question 4. You're providing care to Mr. Arnold Davis, a 62-year-old patient who has just finished eating his dinner. He is lying in bed and appears to be resting. He asks if he can lie down flat in his bed soon after finishing his meal. You know that positioning after meals is important for preventing certain complications in patients with swallowing difficulties or reflux. Based on guidelines for patient positioning after meals and preventing aspiration and reflux complications, how long should a patient remain upright in a chair or elevated in bed after eating before lying down? Option A. A patient can lie down immediately after finishing eating with no waiting period necessary. Option B. A patient should remain upright for approximately 15 minutes before being allowed to lie down. Option C. A patient should remain upright for approximately 30 minutes after eating before being allowed to lie flat in bed, as this helps prevent aspiration and reflux. Option D. A patient should remain upright for 1 hour after eating before being allowed to lie down. The answer is C. Standard recommendation is to keep the patient upright for 30 minutes after meals to reduce aspiration and reflux risk. Option C is correct. Option A is unsafe. Option B, 15 minutes, is too short. Option D, 1 hour, is longer than necessary and may not be practical. Question 5. You're assisting with documentation of patient care and learning about proper charting procedures. Your nurse supervisor is emphasizing the importance of thorough and complete documentation of all care activities that you perform. She is asking you what information about patient care should be documented. Based on standards for documentation of patient care activities and the importance of thorough medical records, what information must be documented about patient care provided by a certified nursing assistant? Option A. Only procedures or activities that did not go according to plan or that went wrong should be documented. Option B. All care activities provided, the time they were performed, any observations made, and any changes or concerns noted during the care should be documented completely and accurately. Option C. The nurse will document everything automatically, so CNAs do not need to document anything themselves. Option D. You should only document care if the patient specifically requests that you write something in the chart. The answer is B. CNAs must document all care given, observations, and any issues. Option B is correct. Option A is wrong. Both routine and exceptional care should be documented. Option C is wrong. Nurses do not document CNA tasks. Option D is wrong. Documentation is a professional responsibility, not patient-driven. Question 6. You're assisting Mr. Henry Thompson, a 70-year-old patient, with passive range of motion exercises for his upper extremities. The patient has limited mobility due to recent surgery and is unable to perform active exercises independently. You are gently moving his arms and shoulders through their normal range of motion. As you move his right shoulder, he begins to wince and reports pain, and as you continue to move the joint, his facial expression indicates increasing discomfort. You need to determine the appropriate endpoint for range of motion exercises. Based on proper technique for range of motion exercises and the importance of preventing further injury, when performing range of motion exercises on a patient, you should move the joint until Option A. The patient experiences sharp pain or significant discomfort, at which point you continue moving slightly further to help stretch the muscles and increase range. Option B. The patient feels gentle resistance or mild discomfort without sharp pain, at which point you should stop and move the joint in the opposite direction. Option C. The patient's muscle begins to quiver visibly, indicating that the muscle is being adequately stretched. Option D. You have completed exactly 100 repetitions of the movement regardless of how the patient is feeling. The answer is B. ROM exercises should be performed to the point of gentle resistance, not pain. Option B is correct. Option A is wrong. Sharp pain indicates injury. Never force beyond that. Option C is wrong. Muscle quivering may indicate fatigue or injury. Option D is wrong. Repetition should be appropriate, not arbitrary. Patient response guides the exercise. Great job. Don't forget to subscribe. Bye.